This video is going to be talking to you about neck pain and kind of the symptoms around neck pain. And of course, as in all of the videos, we'll be reminding you before you start any stretching program, it's a good idea to check with your medical provider. I want to explain to you the muscle structure of your neck and what the problem generally is. Now, most of the time, people describe pain in the back of the neck, right at the top of the shoulders. And that is where they're feeling the pain, but that's actually not where most of the problem is coming from. Most of the problem is dealing with muscles that are in the front of your neck. I'm going to be using the names of these muscles. Again, I encourage you to look them up, get familiar with them, understand what they do. First, the three muscles that are mainly the muscles of the front of the neck are called the scalenes. And you have anterior, medial, and posterior scalene. You can see the tendons of those scalenes here on my neck. And then the other muscle is this big muscle right here called the sternocleidomastoid. The function is when they contract on both sides, they pull that chin forward, which is part of our problem. When they contract on one side, they turn the head to the side. And I can't tell you how many people come to us, mainly because they can't see the cars behind them when they turn. So this is what has to be corrected before the pain is going to go away in the back. Now, the muscles in the back of your neck, whose job is the opposite of this, they hold you back. Those muscles are overstretched, where these muscles are shortened because of being in the contracted stage so much. The other important thing about these front neck muscles is there's something called the brachial plexus, which is made up of a bundle of nerves and blood vessels that actually feed your whole arm. So this brachial plexus actually travels kind of through this sets of muscles, and so they can be acting, when they are shortened, they can be acting like a scissors, literally clamping down on those important blood vessels that have got to get through to here. So many times you can be actually having symptoms in the whole arm that's coming from here. We tell people it's kind of like a hose at your garden, and there's the faucet, and the flowers are way out there, but it's kinked at the faucet. It can be compressed and kinked sort of right here, and you're not feeding the flowers down in your hand. So we've got to get this opened. Now the other muscle that gets involved is a muscle that everybody points to, that spot right there at the top of the shoulder blade, kind of right as the little bone sticks up. It's called the levator scapula. It too is coming off your cervical vertebrae. These scalene muscles in the front, they're all attached on the front of the vertebrae. See 1, 2, 3, 4, 5, and 6. They overlap each other. They come down and attach underneath the clavicle, this bone here, onto ribs 1 and 2. The levator scapula, it too attaches onto C1, 2, and 3, but a little bit more towards the back. And it comes down the back, kind of beside these scalenes, and it attaches right on the superior angle of your scapula, your shoulder blade. And its job is to shrug your shoulder up. And that's a problem. Many people they're either carrying something chronically, or they're just bringing their ears and their shoulders together due to stress. They're driving like this, they're on the computer like this, and so that muscle too becomes chronically short, gets a lot of scar tissue in it, and it is a very, very tender spot. These muscles and that muscle can lead to headaches too, but also it's primarily going to be causing you neck pain right across here. In the next video, I'm going to be showing you specific stretches to do, how to do them, but most importantly, how to work the front of your neck muscles and to work this levator muscle. Thanks so much. See you in the next video.